have you here. My name is Chantal Caro. I'm going to be the moderator for this session, which is titled Healthy Aging Roadmap, Navigating Aging Resources in Your Community. I am an assistant professor at the University of North Carolina at Greensboro in the gerontology program. And I'm excited to introduce to you all this morning's panelists. I'm going to start from my left to right and go down the table. So here we have Linda Miller. She's the director of the Centralina Area Agency on Aging, which serves the 9 counties surrounding Charlotte, North Carolina, and is one of 16 area agencies on aging in North Carolina. We then have Heather Burkhart, who is currently the executive director of the North Carolina Coalition on Aging and has over 25 years of experience working with or on behalf of older adults, people with disabilities, and their caregivers, spanning both the nonprofit and state government sectors. We then have Sam Matthews, who is executive director of the Shepherd Center for Greater Winston-Salem, an interfaith community-based agency providing services for older adults in Forsyth County. Sam is a member of the Forsyth County Aging Services Planning Committee and past chairperson of the Age-Friendly Forsyth. And then we have Dr. Cheryl Greenberg, who is a community educator with the Alzheimer's Association and a life coach for older adults and their families who are in transition, supporting clients who are dealing with health issues including dementias and navigating changes, caregiving, and the emotional impacts of these conditions. All of them have really great bios in your, what do we call them, planners, books for today, for today's conference. So I encourage you to check those out after today's session. So we're thrilled to have each of you here with us this morning, and I'd like each of you to take a few minutes to share about your organizations and the types of support and services you offer to older adults. And I'd like for us to start with Linda, and then we'll work our way down.
Absolutely, and if you're comfortable with it, so that you can see my mouth as I speak, and you're far enough away, we're going to go ahead and take these on, then I'll put it back on when Heather speaks. Okay? Good. All right, I'm Linda Miller, and I'm the director of the Centralina Area Agency on Aging, and we serve the 9 counties around Charlotte. So you're wondering, what are you doing here? And did you really want to drive an hour and a half? Well, I came because Krista had contacted me, and I am the president chair of the North Carolina Area Agencies on Aging. And I thought, well, you could be from all over. And I wanted you to know that there are 16 area agencies on aging in North Carolina. There is one serving each of the 100 counties in North Carolina. So you should be familiar with yours. And you could go to our website, which is nc4a.org, and all 16 will show you, and they'll show you the multiple counties they cover and how to reach them. So generally, we pretty much do all the same thing. Area agencies on aging are mandated through federal legislation everywhere across the United States. So if you have an older sibling or you have a parent and they're in another state, Google the Area Agency on Aging, because there has to be one in one form or another. They may cover one county, they may cover, like in Arizona or Utah, you know, half the state. So, but I want you to know that that's a resource for you. Do we all do the exact same thing? Not exactly, but you'll find out, and it's a really, really good starting point, okay? So in North Carolina, generally, and where's my timekeeper? She's back there. Okay. Generally, we get what they call the Older Americans Act funds. That's the single largest federal piece of legislation that is 50 years old, right?
A little more than that.
A little more than
Yeah.
50. Maybe we're up to 52 now. 52 years old that gives services for older adults. Some you're going to have heard of, Meals on Wheels or home delivered meals. The Ombudsman program, which are advocates that go into long-term care facilities to help you with navigating the whole system, or navigating a complaint that your loved one may have, or a residence rights violation. Funds that. But it funds too much for me to get into right now, but I want you to know that North Carolina puts it together. It doesn't stand alone. We put it together with state funds that your state legislators give us, and they call it block grant, Home and Community Care Block Grant, HCCBG. Did I steal your thunder?
No,
HCCBG funds. So you get about 45% federal funds, 45% state funds, 10% local match. And then each county, it's doled out according to this formula, each county decides, filtered through us, funds that go out to the county that can pay for in-home aid services that might help your loved one have personal care services, or do simple light housekeeping. And they also can do what we call respite care, which is, oh, you're so
The
good.
handout. They all have
You
the
all
handout.
have the handout. Respite care is having someone come in the home so that the caregiver can get out of the house. It will also, we talked about congregate nutrition is when they go to a centralized site and eat a meal together for a couple of hours and then go back home. Home delivered, of course, is for the more homebound, frail older adult. Evidence-based health programs are programs for, I have diabetes. How do I manage my diabetes? And these are programs that have gone through research, and they're proven to get the same results over and over and over again if we teach them according to our licenses and as that we're mandated. Dealing with chronic disorders, diabetes, falls prevention, how to prevent falls, being a better caregiver. We have an array of evidence-based health programs. Family caregiver support is also part of the Older Americans Act that provides services in the home for someone caring for their loved one in the home. Respite we talked about in home aid. The Older Americans Act provides money for us to provide information and assistance. I just don't know where to start, Linda. Where do I go? This is what I need. Here's my problem. 9 times out of 10, we'll give you to your local provider because we're primarily pass-through agency. We want it to go local so that you can get that money at your level. But we do provide some services directly through us, such as the ombudsman, the evidence-based programs, and so forth. We do some shift. We have a couple of trained counselors, but I think that Sam's going to get on that. And we provide some money for adult day health services, but we don't provide it directly. So the Older Americans Act does mandate that they're 60 and up. Younger than that, if you have a loved one, then that will help you get connected with other services, but we cannot provide services under 60 with the Older Americans Act services. So we're there as a resource and community, at least to get started through us. We've been there forever. Your local is the Piedmont Triad Council of Governments if you live anywhere around Winston-Salem, Greensboro, and so forth. So you can look that up. If you're outside of the region, go on that nc4a.org. Maybe your loved one lives outside the region, so you need to call that AAA. All right? Good?
Thanks so much.
I think they're gonna hold, are you gonna hold questions?
Yeah, if we want to hold questions until after their intros, and then we'll get to questions. Thank you so much.
So it's my turn.
Yes.
Okay. I don't know, it's gonna be stuck to my earring. All right. So excited to be here. Thank you guys for having me. So I'm with the North Carolina Coalition on Aging, and I think I'm a little bit different than Linda here and Sam, and because we are a statewide nonprofit organization dedicated to improving the quality of lives of older adults through 3 things, and they're through public policy, through advocacy, and through education. And so when you hear Linda talking about a connectedness to programs at the regional level and local providers, and Sam is doing excellent work with administering programs and reaching out to communities that will be a great resources for your church to connect with. We are a large coalition of almost 100 organizations that come together to lift up the voices of older adults, to make sure that we are part of policymaking decisions. You heard Linda talk about the Older Americans Act, which is federal dollars. You heard her talk about state legislative appropriated dollars that go towards older adults in the state, which I will say North Carolina is the 9th largest older adult population in the country. So don't be fooled, we are a growing population. We already have more people over 60 than kids 17 and younger. So North Carolina is ahead of this demographic shift. And so where you're seeing it in your local communities, it's happening across North Carolina. And so our coalition brings together organizations across a whole variety of representation. Some are state level organizations like NC4A or AARP. We also have local providers like departments of social services and senior centers, and statewide advocacy organizations like the Justice Center. And so we're really about making sure that decisions about older adults are being made in a way that can help improve the quality of life, that we have adequate funding, and that people know broadly about resources and services. And so we have been championing efforts for Medicaid expansion. Often people don't think about the needs of older adults around lack of health insurance because they think, oh, they have Medicare. Well, not every older adult has Medicare, and you shouldn't have to wait till you're 65 to have health insurance. And so there is a portion of people who are between 55 and 64, about 60,000 older adults that do not have health care insurance who could benefit from Medicaid expansion. We work to promote expansion of home and community-based services. Over and over, you hear older adults and caregivers, people want to age in their community, and that's what we want. We haven't kept pace with the services and funding for adequate home and community services, and so that's something we lend our voice to. Quality long-term care in facilities, right? They provide an essential care for people who maybe don't have family support, maybe have really high acuity needs. Families get tired and need that when people have really long-term 24-hour medical care. And so we want to make sure that that care is there and that we have direct care workers who are doing that work. We have a severe direct care workforce shortage right now. And you guys probably know that. And it doesn't matter what setting you're in. You could have a loved one in a long-term care facility. You could be trying to get respite or going to an adult daycare center. It's hard to find direct care work. And so we are doing that work at the policy level. And so that's kind of who we are. And I see it, and hopefully you'll see it as we move through kind of each of our updates, that we all work together, right? So we are a network of people doing this work and trying to impact change, whether it's at an individual level or connecting with communities and bridging out and doing outreach to connect, or bringing our voice at a larger sort of legislative advocacy, sort of systems change work. And so I think my thought is, and the message is, no matter where you are in that, there are people who care and are doing work for older adults and caregivers for you to reach out to. And I'll say we are always looking for new partners in that work, in no matter what that is. And so if what brings you today is thinking about how you can take this information back to your congregations, whether it's your church working with another organization or just connecting families to services that are out there. There's a variety of people who care about older adults and who want to make sure that we have resources and a roadmap to get you there.
Thanks so much, Heather.
Thank you.
Well, good morning. I'm also very pleased to be here, and unlike these folks who represent multiple entities, I am with the Shepherd Center of Greater Winston-Salem. We're an interfaith ministry that provides services for older adults, direct services, volunteer opportunities, and enrichment programs. On the table back there near the fireplace, there's a brochure and our spring newsletter. It may give you a little bit of a better overview of who we are. We're in our 37th year in the Greater Winston-Salem area. We serve about 80 to 90% of Forsyth County. We're part of a national network, the Shepherd Centers of America, that was started 50 years ago out of Kansas City, Missouri. And there are 4 affiliates in North Carolina currently. One in Charlotte, one in Greensboro here. We also have 2 in Forsyth County, the Shepherd Center of Greater Winston-Salem and Kernersville. We serve different geographic areas. Some of us are what I call full service centers, like ourselves and the Shepherd Center of Kernersville. The Shepherd Center of Greensboro and Charlotte probably lean more towards lifelong learning programs for active older adults. We are a certified senior center of excellence, one of 2 in Forsyth County. The other one is the other Shepherd Center, which is unique. The other thing that's unique about our county is that the aging services predominantly are provided by private nonprofits. Many of the counties that maybe some of you are coming from, the services are provided by the County Department of Social Services. It may be under aging services or what have you within the county. So we have a unique opportunity within the Forsyth County area to provide services where there are gaps and also unique service needs. We have 2 program areas. One is our Faith and Action Care program, and that program provides transportation, minor home repairs, and family caregiver support services. Now, speaking of home and community care block grant services, we do receive funding through that program as a senior center. And as a multi-purpose senior center, we do provide transportation and home repairs, although in some counties those are funded services through the home and community care block grant. In Forsyth County, transportation is a funded service, and our transit authority through their paratransit organization gets that funding. However, there are many gaps, what I call transportation deserts in Forsyth County. So we serve a vast majority, and the largest program area that we have is our transportation services. We responded to over 15,000 one-way trip requests last year. We remained open during COVID, and our volume of requests went up. The number of people served went up. Last year, we were fortunate, challenged, and had the privilege to serve approximately 7,000 older adults in Forsyth County. Through our Vital Living program, which is really our senior center component for activities for active older adults, we have about 40 to 50 activities per week. We're considered by the State Department of Aging and Adult Services as a center without walls. We know that we cannot do everything within our own facility. So we have multiple locations. Many of them are in congregational settings where we offer exercise classes, lifelong learning opportunities, other kinds of activities that may take place in those areas. We offer Tai Chi, warm water exercise, yoga, things that will keep people healthy as they age and active. We have partnerships with both of the medical centers in Forsyth County. We get a lot of referrals for our activities, exercise activities to improve balance and strength, particularly warm water and Tai Chi have been shown as evidence-based to be able to serve those needs. In addition, we are the county coordinators in Forsyth County for the Seniors Health Insurance Information Program, which I think is listed on that other list that you have on the tables. We provide outreach to about 1,000 individuals, 1,000 beneficiaries per year. We do monthly Welcome to Medicare workshops for people getting ready to go on to Medicare. We do individual counseling throughout the year to assist people going on to Medicare, and then during Medicare annual open enrollment, which begins in about a month, which is a real heck of a time to do it during Thanksgiving and getting ready for Christmas. But Medicare open enrollment is the time where we see a lot of beneficiaries. And we work collaboratively with the other agencies in the community who also may have SHIP-trained counselors. They sort of fall under our general direction as they serve their beneficiaries. One of the largest entities in Forsyth County is Senior Services. We do not duplicate services with them. They handle information and referral, Meals on Wheels, home health, those types of things. So all of the referrals that we get, and they're significant for transportation, home repairs, lifelong learning opportunities, exercise activities, all of that is referred to us. So we have a very collaborative relationship with them and other partners, including the Department of Social Services. Just talking about funding real briefly, we do get home and community care block grant funding, which is vital to senior center operations. We also get state funding for what's called senior center general purpose funding. If you have senior centers in your area, they may get funding from 2 different sources. That funding is state level. Fortunately, we also receive city funding and county funding, and we get some federal funding through the Federal Transportation Administration, which comes actually through the city as a pass-through for transportation support. So that, in a nutshell, is who we are, and just privileged to be offering the services we do in our community.
Thanks so much, Sam.
Thank you. Well, I am going to take my mask off. I actually represent a different point of contact. I'm here today as representative of Alzheimer's Association, but you know that sort of at the grassroots level, we all need a lot of information. When there is a disability or a disease, or any number of other things that concern us with aging, I mean, hopefully we're all going to be 100 years old without any problems, but when we have a concern, we need information, we need support, and you heard that that's available in all the 3 presentations you just heard. What I'm going to talk about is something a bit more direct, and just remind you that almost every organization that represents a major illness or disability that's related to, that we see frequently in aging, also provides us with resources, information, education, and sometimes other direct resources. Make sense? I mean, if you want to know more about heart disease or cancer or Parkinson's disease, there are websites you can go to download information, and also, in many cases, to make a direct local contact or virtual contact. Alzheimer's Association, of all the organizations that I volunteer with, seems to me to be among the, or I won't say it's the richest resource, but it is an enormously rich resource for information about Alzheimer's disease and other dementias. So you know, dementia is a general term, and there are lots and lots of dementias, lots and lots of diseases that are types of dementia. Alzheimer's number 1. 60 to 80% of people who have dementia have Alzheimer's disease. They provide information about Alzheimer's, but also, as I say, about other dementias. So how do we get there? You know, how do you get the information? Well, first of all, there are 2 big things. One is there is a 24/7, every day of the year hotline, and it is supported by master's level clinical, generally social workers, who are ready to answer whatever concern a person has, whatever need for information a person has, to answer that call at 3 in the morning when you just don't know what to do. You're providing care for somebody who's wandering, you don't know what's next. It's a wonderful, wonderful service that you can rely on. As I say, these are trained people. The other thing that is sort of the big picture is alz.org. That's their website, alz.org. And that's where you can just get a wealth of information. There are articles, videos, connections to programs on absolutely anything you can think of. I downloaded a bunch of, just to give you an example. There's information about Alzheimer's itself, attitudes towards Alzheimer's. How do you communicate with family members to tell them about Alzheimer's? What do you do about caregiving? How do I deal with stress of caregiving? What are the symptoms? How do I know? What do I do if I do suspect? You know, on. And even healthy living things happen. What do I do to keep myself as healthy as possible? To delay, possibly, the onset. You know, you get the idea. There's anything you can think of. I go to alz.org and look for it. Now that said, it's pretty easy to think you get overwhelmed, right? So Alzheimer's has done a bang-up job of doing interactive programming on the website. For example, if you just click, if you go alz.org/navigator, or you just write the word navigator, up pops a form that you can fill out. It's a short form and it's private. You don't have to give your name or any, you know, it can be confidential. And you're asked a couple of leading questions. So what are you looking for? And who's this for? And what's bothering you? And then these things are all digitally, magically connected, and you will get resources to read. You'll get, you'll find out about who in your local community you might reach out to. You get tips, so you'll get easy to read and hard to read stuff. You know, you want the research, it's there. You want a simple guide, it's there. So that's Navigator. And essentially it is it's sort of modeled to, fashioned for your particular question. At the same time, there's something wonderful. Again, you click into alz.org/connect, and you get to a bulletin board. Do you remember bulletin boards from about 20 years ago? Right? We just chatted with everybody. We didn't know who they were. They were in China. We didn't know who they were. Well, this is, again, there's a form in the beginning so that you can be guided to a message board with people in there who are interested in the particular thing that is calling your attention. So worried about early onset Alzheimer's, young onset Alzheimer's. I need to find out how to approach this, how people are living their lives. And you'll go to this message board where you can post questions, read answers from caring people. This is not the professional side. There might be professionals answering your questions, but it could just be you and I, you know, who want to reach out and say, here's my experience. And by the same token, you can participate and sort of develop a little bit of a sense of community. Here's other people who are asking the same questions, and I can give them some advice as well. So that's connected. ALZ connected. Let's see what else. Alzheimer's Association has a lot of programming around specific issues in Alzheimer's or other dementias and healthy living. They are established programs. You can, I'll get to local in a second, but you can go online and see videos about what are the signs of Alzheimer's or how do I keep my brain as healthy as possible. Download a video. Let me get to the local, because this is all stuff you can do through the website. Sometimes we just want to see a real person. There are chapters all over the country, and that's where you get that direct connection. So upstairs there's a table where Karen Owens, who's the social worker for the Greensboro area, she works for a larger chapter called Western Carolina. Those folks plan education programs virtually or in person. People like me travel around or get on the computer and provide the program you want for your group. You want to know how to communicate with somebody who is losing their ability to communicate with words. I'll come see you. You get your folks together, and I'll come give an hour program on that. So we have community educators at the local level. We also have both online and virtual support groups. And I am a big, big proponent of support groups. That's the message board, communicating with other people, but now these are people you can see face to face, you know them, you develop an ongoing relationship of support. We also do, and I'll just say this really briefly, Alzheimer's Association is the largest nonprofit funder of research connected to dementia in this country. And we can encourage people to join something called Trial Match. It's an opportunity for folks who want to be part of a trial research to sign up to be told when some research is coming up that might be something that they would be appropriate for. They get to contribute to the research about stopping Alzheimer's in its track. At the same time, you know, they get the privilege, the benefit of whatever's being researched. And got 1,000 other things, but that gives you a taste. And also remember that gives you a taste of looking at diabetes.org, Parkinson's.org, American Heart Association. They also provide that kind of information in their areas. I think it's a good taste.
Thanks, Dr. Huber.
So I'm looking at our time, and I know there was a hand before, so I think I might switch things up if everyone's okay with it. And someone had a question over on this side? Yes? Okay, no worries. So then I'm going to go to my question, and then we'll field questions. So I'm going to pick one, and I think this one I find most interesting, at least for me, based on some of the things that you've all mentioned today. And feel free, anyone on the panel, want to take this away first. But what do you find to be the biggest barriers or moments of hesitancy people have toward reaching out for assistance? And if you're familiar enough, how do you see faith communities helping bridge some of those barriers?
I have a short one, and that is people don't know. They don't know that you exist. They don't know that organizations that can provide education exist. And so people will tell me after their loved one has had Alzheimer's and passed, they'll say, I wish I had known. I wish I had known you were there.
And I would say people are overwhelmed with being in the situation and just it's almost to that take a moment that we talked about earlier today, but you're just in the trenches, you're slogging through, you don't know what's out there, and you can't even look ahead to say, is there something out there? And I think and Linda talked about it too, we get phone calls from people who, they don't call and say, oh, I need a home modification. I need a support group. That's not what people call us for. They go, let me tell you, so my mom is 87 and my dad is 92, and you get the whole story because people don't know the resources, but they don't even know how to separate what's going on in their life to be able to tell you what they need. And so I think that and it could be not an older adult themselves, but people don't necessarily plan for advanced age and don't know what's out there. They assume Medicare is going to cover everything. They don't know how the responsibility of caregivers can be overwhelming, and I think that's the main message. So I would say to the second part of the question, and then I'll let somebody else chime in, I think just to be observant to people's situations and friends and neighbors, to know if they are trying to balance caregiving and aging, that you reach out and be a kind ear and ask how they're doing and if there's anything, and then be a bridge or an advocate to some of these resources and encouraging them to say, there might be something that could help you, or there might be something that could help your mother. Let's connect with something bigger, and that would be my advice.
These guys couldn't be any more perfect and spot on. I'm going to layer on top of that a couple of things. there's still a lot of older adults who don't want to accept service yet. A lot of different reasons. People are still timid about COVID and having someone come in the home. A lot of people are still really, I don't need help. I've never needed help my entire life. I don't want to call it pride, but it kind of is. And I think the support of a congregation and where people fit in, helping them see that there is no shame to accepting support. There is no shame to accepting help. This is what you all are all about, helping each other and helping them see that it's okay. There'll be your time to say, I need help, and there'll be your time to say, I'm going to give you help. And as you reach the end of your life, you're probably going to say, I need help more often than I can provide help. So I think that's really, really important still. And just get them started someplace, even if you don't know. It's okay. Sam is never going to take anything that he can't take, but he will get you to the right place. And that's what's so great about our aging network, I think. I think it's one of the best. Besides the best kept secret, we're also very well networked with each other and support each other and will help you get to the right people. So
I think also if we step back, we all deny that we're aging. We're an age-denying community, world.
Society. Yeah.
Every focus is on the youth and your vitality and living forever. We don't get out of this alive, right? So really, what we need to do is start planning. Hospice a number of years ago started a big nationwide thing. We got plans. Do you have healthcare power of attorneys? Do you have living wills? Those types of things. What we experience and our partners experience in our community is people wait till the 11th hour. Mom's had a stroke, she's in the hospital, she's leaving. We need grab bars in the bathroom, we need a ramp, we need doors widened. Where do we go? How do we? And sometimes they know where to go, but they're coming at the 11th hour. They haven't thought ahead. And so as a congregation, what you could do is have partners come in and talk about aging in place. You could talk about Alzheimer's. You could talk about services available in the community so that people are aware that, at least in the back of their mind, oh, I heard that there's a group in our community that builds ramps, or there's a group that installs grab bars, or can provide transportation to get us to medical appointments. So quite often, when you're in the heat of the very toughest part of it, you're not thinking logically about all of that. But if you've got some preparation for that, that would be, to me, very helpful.
And I think too, it's such people have a hard time thinking of themselves as aging and planning. But what it does for families, if somebody has planned and has advanced directives or has thought through, those things that are important to them and documented them or shared them, I think the other strategy is think about the gift you'll give to your kids or your loved ones if you go through some of this exercise, that it really takes the responsibility off thinking about myself and my own planning, but it does help other people out.
We had a question?
I just want to share that I had the experience personally. My mother died 21 years old prior to that, 3 years of failing. None of these were available, or we were just coming into the case of Alzheimer's to the point where she recognized none of the provider facilities. And the resources were not there at the time. This is an understatement. But I'm very aware of what you're saying.
Right, so you're speaking to our knowing more about what's out there. That's very interesting.
So thank you for the presentation. I'm really excited as I turned 49 this year, so those numbers get older all the time. And I really love what you said about none of us get out of this alive. That kind of reality check with humor is just that kind of stuff I talk to my kids about all the time. So what's really interesting to me is that we do live in a state that has this really robust ecosystem of organizations at the local and regional level. And it is really interesting because there's almost like there needs to be a marketing campaign to let people know what actually exists. Because the knowledge is uneven, right? And particularly in rural communities where people are isolated and there's transportation needs, things psychologically, there's even a psychological barrier to access, even if you're in a rural community. I was in a county down east earlier this week, and we were actually having a community meeting talking about Hurricane Florence and how things have changed since Hurricane Florence down on the coast. And one person who's a community advocate asked the assistant county manager about the health department and services for aging people and sort of how did we handle working with our elderly during Hurricane Florence, and how have we continued to come together for the number of years since Hurricane Florence, and how can we be prepared for the next hurricane as it relates to what we're talking about here today, and sort of the inevitability of not only aging, but aging and other crises on top of that. The assistant county manager said, I don't really have a relationship with the aging resources or the health department, which of course is under his jurisdiction. He said, so I really can't comment on that right now. And this was a room full of everyday folks, right? Who all of a sudden felt like even more disconnected because they thought they had an expert in the room that could address the issues they're talking about. So, to me, luckily there were some volunteers with the long-term recovery group that was there, and they could speak to some of the concerns. But it was really disappointing to see multiple county employees in the room not being able to address the services that they actually should know something about.
That'd be fun.
Go ahead, Sam.
I was just going to say that, to comment on that, you're absolutely right. There needs to be a information blitz, but it has to be where people are. Newspapers are dying. You can't afford them if you even have one in your community. A lot of older adults are not tech savvy, so they're not going onto websites and that type of thing. This is where faith communities and churches and congregations can fill that. You've got people coming day in and day out. Have community resources come in. Talk about those resources. Have their resource information in the church somewhere so that people can become familiar with what's in their local community. What we find is that we and our partners in the community have been advertising and promoting. We don't have any problem with finding people for services. They're knocking on our door all the time. So it's the people who don't know that we exist. The other flip side of that, just to point out a reality, we talked about the Older Americans Act before. One of the problems that we have as aging providers, and AAAs have this constantly too, there's more demand than there is money. The Older Americans Act is limited. It gets cut here and there. The resources are not there. So one of the things that we run into in our community is people knock on the door and say, I need this. And they say, okay, we'll put you on the waiting list. How demoralizing is that? So there's an expectation there. So this is where congregations can also lobby for increased funding for services for older adults at the community level, state level, national level.
And so the brief question is, what you just said there, I mean, y'all would be good thought partners to think about advocacy strategy.
I would
correct?
say that actually what you're saying is really powerful, but I don't think we've said enough about how hard we all work at making those connections. And one of the reasons we're here today is to encourage you to bring this information, to let us come and bring this information to your congregations. Our staff at the volunteer level, at the communities volunteer organization I belong to, are all meeting continually and working continually on trying to make connections with your ministers, with your staff. But we're not, we need those responses, we need those entrees.
Yeah, and this is where Heather's organization comes in. I mean, those sort of grassroots, statewide advocacy organizations that mobilize people and mobilize efforts and can get your voice or help you get your voice to your legislators. She does a lot of state, but of course there are organizations that do similar things federally
And-
with the Older Americans Act. But that's a problem. I don't want to paint a great rosy picture, and you know, because the help is out there. But I'm going to tell you that there are wait lists. They're just not the resources, and so that's where the local people get creative. Maybe you know, they're on a wait list for family caregiver services, and your church decides to do some support groups, maybe with some support from the Alzheimer's organizations, or you form your own adult daycare like you said you had. You had daycare for a little bit of respite, a few hours a day. We call them group respite when they're not open all day, and we have a couple that do that, all volunteer run through churches and through organizations. Or you have people that'll go sit with someone, which is something hospice does real well. They place a volunteer in the home of someone so that the caregiver can get out well too, and they don't have to be a CNA or anything like that. But it is not, we are nowhere near what we need for the funding for the wait list. And our services, you cannot ask for income or any assistance from the person at all. So we have no clue who's on the services. I don't know if they have $10 million in the bank, I'm exaggerating, or they're living paycheck to paycheck and can't pay for their medications. It's just the way our services run. So I think we also need, and this is never popular, but I'm going to go for it, we need people who have really, really good, solid resources to maybe consider paying for them, so that people who don't have them have a more wide open track to getting what they need. So that's not popular, but it's true, right? Back museum.
Just to piggyback on that, and I'm just speaking as
Sorry.
Go for 30
just as-
seconds in.
Just as a local organization, we have about 25 faith communities that provide financial support to us that helps. So if your community has an outreach budget, look at the agencies in the communities who have significant needs serving older adults for healthy aging.
Can
And-
a church donate to a Trouble Life?
Well, you might do better donating
To-
at the
to an
local
agency that's
level.
in your area.
We're not really a nonprofit, any of
It
us.
may be the Meals on Wheels organization in your community, or it may
Yeah, I
be-
think that makes
or
more
it may be
sense.
an adult daycare center. Everybody is stretched, so any, $100 would go a long way for a lot of
I am
agencies.
so sorry to be the bad person. I know we had a couple of questions. Blame it on me. We were all very chatty. So I really appreciate all of your time this morning. Maybe in the 10-minute break, you can kind of catch one of our speakers if you had a probing question you wanted to get asked. But I just wanted to thank Linda, Heather, Sam, and Dr. Greenberg for being here with us today.
Thank you.
For more information, feel free to check out PHW's interactive map at healthandwholeness.org. For more information on each of the organizations that are here today, check out your schedules for the next workshop that starts at 11:10, and have a great rest of your day.
Thank you very much.